So we're going to bring in our chief health editor, Dr. Partha Nandi, now joining us to explain why the CDC has expanded its stance on masks. Dr. Nandi, take it away.
Yeah, Glenn, so I've always said, right, and you've heard this many times, that my mask protects you and your mask protects me. But now you'll be hearing me say something a little different, that my mask will protect both you and me. And you know that I've been a strong advocate for mask use, mainly because I see firsthand how it protects me, my patients, and my staff and my practice. So I'm happy to see that the CDC has updated its guidance. Now, so why did they do this, right? Well, because of science. Now, studies have shown that cloth masks can reduce exposure. They help by filtering out respiratory droplets. Now, respiratory droplets are the main way that the virus is spread. It happens when folks talk, cough, sneeze, sing, or even breathe. Even me talking at this kind of volume will be enough to spread it.
Doc, we've learned a lot, certainly, since March. Seems like this could have come much sooner, but share some of the studies that support this decision ultimately.
100%. A lot of us saying, listen, I wish we'd known this sooner, but the CDC cites several human studies where masks made a difference. There are a couple I'd like to share. The first concerns an outbreak that happened aboard the USS Theodore Roosevelt aircraft carrier. Now, a study found, Dave, that face coverings reduce the risk of getting infected by 70%. That's an impressive number. Amazing, because the enlisted men and women aboard this vessel often work and live in very close environments. Also, another investigation looked at two symptomatically ill hairstylists. So they had symptoms, and of the 67 customers that were interviewed and tested, none of them caught the virus from the hairstylist, and all of them had worn masks. So this really tells you, that this can be really effective.
That is a huge difference there, Dr. Nandi. You were talking about cloth masks a minute ago, saying how they filter out droplets. We know there's N95 masks, all kind of scarves and facial coverings. So what is best, and how do they filter out the virus?
Now, I'll try not to get too science or technical on you, but here's what I'd like you to know. Cloth masks can effectively block most large droplets, right? Roughly, we say the size of 20 to 30 microns or larger. They can also stop fine droplets and particles that are 10 microns or smaller. In fact, multi-layer cloth masks, right, have shown that they can block between 50 to 70% of fine droplets and particles, and which is amazing. Remember, those are the fine droplets that can carry this virus that we're all really concerned about.
So thread count matters when it comes to our masks.
100%, David. Thread count absolutely matter. Now, the higher thread counts, around 180, are much better than lower thread counts, right? So if you're not sure if your mask is tightly woven, do this: hold it up to the light, right? And if you don't want to see easily through these masks, you don't want to easily see through these individual fibers outlined, right? Remember, the reason why we're wearing the mask is this: because more than 50% of transmissions come from folks who look great, who have no symptoms. That's the issue. So I love that the CDC has updated its guidelines to show people that it can also protect them and others. Really important in the fight against this virus.
All right, Dr. Nandi, thank you. We appreciate your advice as always.
My pleasure.
Mask up, everyone.